Good morning, everybody. Welcome to the Certified Nursing Assistant Training. We're in week 1, day 1, and you'll be working with me for the next 8 weeks. My name is LaKeira. I'm the healthcare instructor here at Goodwill. If you guys have any questions that come up or anything that needs to be answered, do not hesitate to ask, and we'll answer them to the best of our abilities. All right, so we're going to go ahead and get started, and we're going to focus on, during this session, gaining employment, engaging employers, professionalism, types of nursing assistants, and sympathy and compassion. Everything that we're going to talk about today ties into each other hand in hand. Whether you believe it or not, or thought about it or not, everything goes hand in hand with each other. So when it comes to planning your job search, we ask this question: what's the first step in planning your job search? Because there's people that's in this course right now that has not either had a job or went on job application hunts and didn't really have a plan for their job. So it just felt like they were running around in circles. So we just asked, what's the first step in planning your job search? What would you want to do to make your job search a little bit smoother and easier for you? All right, so when it comes to gaining employment, you want to plan your job search. You want to have a plan that's going to help manage your time and increase your chances of success. It'll just help make your search a little bit smoother, and it won't be as frustrating as job searches usually are. You want to identify the right job for you. You want to just talk about what's going to be a good position for you, what company will be better for you, what environment will be better for you. Do you want to work with the elderly in long-term care? Would you like to work with people who are on hospice care and they're at the end of life? It's all depending on how you want to maneuver around and what's best fitting for you. You don't want to go anywhere that's going to frustrate you or run you dry. You want to go somewhere that you can be beneficial at, somewhere that's going to make you a better CNA or a better caregiver, all around the board, even for the company. All right, when it comes to employment documents, you want to think about a cover letter. A cover letter just kind of gives them a short little summary of what they're going to be looking into, what kind of information they're going to receive, what type of person you are. You want to have your resume included. If you have BLS, which is basic life support, or another form of CPR, if you have the certification, it's good to add on, because now in healthcare, that's a requirement. You need to have BLS in order to go ahead and work out in the field, because we just never know if we're going to have to save a life or be assistance to someone saving a life. If you have a CNA certification or a license, go ahead and add that. That's important. That gets you a higher notch on your belt as well when it comes to hiring certain people within the facilities. If you have a criminal background check or a criminal background history, shall I say, don't hesitate to add that. Not all companies look at the bad. Some of them look at, okay, you've been in trouble. What have you done to make it better? What have you done to turn your life around? So sometimes backgrounds don't hinder what you can do moving forward in the healthcare field. Just make sure you're honest in everything that you do. You want to give your employers pretty much a glance at your qualifications and experience, so they know exactly who they're hiring, what they're looking into, and things in that nature. When you fill out the job application, it just gives them basic information when it comes to employment, education history, your references, even some skills that you may have that might be beneficial to the company as well. When it comes to engaging your employers, you want to do your research so that when it's time for you to answer the questions about why should we hire you, or you jumping into an interview and they asking, tell me about yourself, you can answer that question pertaining to the job that you're applying for, the job that you're at the interview for. You don't want to go into a assisted living facility telling anybody that you love basketball or your favorite hobby is singing or dancing, because that's not the answers they're looking for. They're looking for you to go ahead and tell them, how are you beneficial to the job? What skills set can you bring to this facility and make it better for the whole company in a whole, instead of just them hiring you and you being another asset to something that they have to keep training and training. You don't want to do that. This also is a chance for you to ask questions. It doesn't matter what kind of questions, anything that you may want to know, anything that they offer that they haven't mentioned and you want information on, don't hesitate to ask. Pay is a good question to ask about as well, because you might just be suitable enough to make their company become a better company than what they already are. And of course, you want to know the pay so that you know how much you qualify for. You got a lot of most common questions that's asked in the interview process. And it's probably going to be 10 of these questions that you're going to see off rip or no. They're going to ask you these. These are the main questions they really ask. And the number one question is, tell me about yourself. Again, like I mentioned, when they ask you that question, they don't want to know that you like basketball or that you like taking long swims. They want to know about you, your qualifications, what you're capable of doing that's going to benefit the job. That's going to make them want to hire you. Professionalism. You want to understand what's expected of your employees. You're going to always adhere to the policies that they have in place. We're going to keep our certifications up to date. If they lapse, it's going to be harder for us to retain them. And that's something you just don't want to deal with. BLS, it won't be as hard, but finding a company and things in that nature, you just don't want to scramble looking for certain places to go to recertify your information. And that could sometimes pause you during your job and get you a couple of days off until you have to go ahead and renew. So you just want to make sure everything stays up to date. If your CNA license relapse, it might not be possible for you to go ahead and just pay and make sure they're active again. You might have to take a course again. You might have to do something else that just shows why you should be a CNA again without going through the process all over again. It's a hassle. So you just don't want to deal with that. And completing in-service trainings as provided by your employers is something that you're going to have to keep up with within the job. It depends on the job and how they maneuver around that process as well. All right. So here are some things that you want to be aware of and do when it comes to working for these companies, because it's important. It's really important for you when it comes to keeping a job and maintaining a job. Showing the work on time, clocking in and out on your time card, following directions, calling when you arrive late. That's a main one. If you know you're going to be late and it's something that's out of your control, just make sure you call them. Don't get nervous and hesitate to call, and then that hinder you in the long run. Go ahead and call and be honest up front so that they look forward to what's going to happen and they can do something about it. Professionalism. So we're going to always adhere to 6 principles of care. You're going to see these everywhere. You're going to talk about them everywhere. But 6 principles of care that we adhere to is safety, dignity, infection control, independence, privacy, and communication. This is what makes our residents become better within themselves. This keeps our residents going. This lets them know that we're here for them, we care for them, and they open up to us. They make it easier on our job duties as well as on their daily lives. All right, when it comes to a healthcare team, you're just going to remember who your boss is. You got another employee that may ask you to do something. You just want to think, is that patient in danger? Do you have other patients waiting on you? Is that person your patient? And is there somebody else who's supposed to be doing it? You're going to run into a lot of people who ask you, hey, can you do this? Can you do that? And they're not your immediate supervisor or a person that you're supposed to be reporting to. Just remember, if you always be the person to help somebody else complete their task and you fall behind on yours, they're not going to just jump and help you with your task because you help them all the time. They will leave you high and dry, and that's something that you really don't want to deal with. So just make sure you prioritize what you do and how you do it. Am I going to be late or fall behind or have to stay over to make sure everything is done on my end? That's certain little things you want to think about. If I help this person when it's my turn, will they turn around and help me, or are they going to make up an excuse? You're going to get that in the field. So I just want you guys to remember who your boss is, who's giving you instructions to do certain things, and whether or not they're your patients or not, or if a person is in danger. If somebody is in danger, then we're going to always jump in, hands on, all hands on deck. But that's if that person is in danger. All right, you got some important members and their roles when it comes to the healthcare team. A social worker, they help us address a lot of personal and structural challenges that will come up in our patients' lives when working with them. They provide them psychotherapy and counseling on life-changing decisions when it comes to being in the facility or staying home or just transitioning all around the board. You have physical therapists who play an important part when it comes to making sure that we get a person from 30% back to 90% if it's possible. We help with injuries and preventing injuries and work with certain disabilities to make sure that they can continuously function on their own. We have dietitians who focus on people who's malnutritioned and diet-related orders and making sure they get everything they need and they're suitable treated. They get their suitable treatment processed properly as well. Everybody works together. We make sure all of our clients function properly the right way. And then you got an activities director who always has a plan in place, a monthly and a weekly schedule for all of our patients to make sure they stay active and function and mobile and, working together so that they don't fall below the line that we want them to fall below. We want to make sure they always active, they feel good about themselves, they have something to do, they just participating in certain things like they would do normally on their own. When it comes to responsibility, we help with admissions, discharges. We deal with transfers. We focus on personal health, and safety is everybody's responsibility. So if it's something that's putting a resident or a client or a patient safety in harm's way, everybody jumps in, hands on deck. Nobody says I'm better than one another because of a job title. We all act when it comes to safety. All right, so as nursing assistants, we work under the supervision of RNs, LPNs, or licensed vocational nurses, and those nurses travel around from facility to facility. We also are known as resident aides, caregivers, patient care techs, sitters, and home health aides, depending on the environment that we're in. So just remember that we are known as different names. A CNA is a licensed nursing assistant. Everybody else is unlicensed, but they can take care of their residents. Right. When it comes to job requirements, it depends on the location and the job title that they have. Some places want you to have hands-on care to where you have a little bit of experience doing this or being home taking care of someone. Some other people want you to have training, 75 hours, 120 hours, or they want you to pass the license exam. So it depends on the department. It depends on the facility and how you're going to be titled and placed. When it comes to our responsibilities, we focus on ADLs, we focus on vitals, we focus on emotional encouragement, we focus on physical support and safety for ourselves and our patients. When it comes to ourselves, it's making sure that we don't hinder our bodies when dealing with transfers or bending or pulling or pushing. It gets physically demanding in some facilities, so we want to make sure that we keep ourselves safe while trying to take care of our patients as well. Emotional encouragement. We don't want to always deal with somebody who's emotionally stimulated and it affects the way we can maneuver around a facility and how we feel. We want to always encourage them to be the best they can be as happy as they can be. And if they're not, we're supportive as can be so that they can get back to that level. When it comes to the healthcare team, you got a patient, the patient family, and the facility staff. Remember, the patient is always the captain of the healthcare team. In every facility that you go in, they're going to tell you the same thing. The patient is the boss. So you want to remember who the boss is. Even though they may seem like they're not in their right mind to you, if they're deemed competent enough to make decisions on their own, they're the captain of the healthcare team. You got your patient, your family, the doctor, the RN, LPN, CNA, dietitian, and therapist. It all trickles down the line, but everybody has a place and a role to play. When it comes to caregiving, a good caregiver has empathy, validity, compassion, and sympathy. And we're going to talk about how all of that tie together. When it comes to empathy, you want to just try to understand how that person feels, try to walk in their shoes, just understand their point of view without being discouraging. So if they tell you something, you want to understand what they're telling you and how to, handle that when they do tell you that kind of information. When it comes to validity, you want to validate their reason. Why do they feel this way? What makes them feel this way? It's just realizing somebody has a problem versus empathy. We empathize with them, so we understand. We want to walk in their shoes, but now we're validating it. Realizing it's Miss Myla having lost her earrings and she's crying. We realize that because we see that. But when it comes to empathy, we empathize with her. She lost her earrings that her husband gave her, so we can see why she's crying. They're very important to her. It's a valid reason that she's crying. That's what we want to make sure we validify for her. When it comes to compassion, we got to understand how that person feels and want to help them fix what's wrong. This is pretty much empathy plus the desire for action. So we understand how Ms. Myla feels. We want to go ahead and help her look for her earrings. They might be lost. They might not be lost. Somebody may have misplaced them. But we want to show that we feel compassion for her and we want to help her as much as possible. So we're going to jump in and we're going to do the right thing. When it comes to sympathy, we want to show that we're concerned about something that happened. I'm sorry that this happened to you. I'm so sorry you lost your earrings. We just showing that we feel the same way they feel. Even though we haven't experienced it yet, we can understand. We can feel it. So we're going over these responsibilities for nurturing our residents' emotional, social, spiritual, and physical needs. Empathy is understanding. Compassion is stepping in to help, doing something about it. And sympathy is showing that we're sorry about what happened and we understand. So when it comes to a lesson recap, we got empathy, compassion, sympathy. We talked about different healthcare professionals in the healthcare team. We talked about a role of a nurse aide, and we also went through gaining employment. So when it comes to checking understanding, where is care provided for a person who requires treatment for a sudden illness or injury? This is somebody who suddenly became ill, a car crash, a slip and fall, something that just suddenly happened. Where will we be sending them to for treatment? Okay, if you answer C, you are correct. Acute care settings are hospitals, hospice, dialysis center, and psychiatric unit. These are places that sudden injuries just happen and they need the care right away. So we step in and we send them to one of these places for better help. All right. When it comes to this question, I want you guys to read the question and listen to certain words that they're telling you. Miss Marie Evans was admitted to the hospital for pneumonia and was hospitalized for 4 days. What word best describes Miss Marie Evans' care setting? We already know what kind of care setting she's in. What word would best describe her care setting, though? Okay, if you said C, you are correct. She was admitted to the hospital for pneumonia. So we know that she was hospitalized. Acute care setting describes the environment overall, but what setting, what word best describes the care setting that she's currently in, which is the hospital? It's going to be some tricky questions like this on a test. So I want you guys to understand how they ask you these questions now so that when it's time, you'll be able to get through it. All right, true or false? To protect yourself, the person receiving care, and your employer, you have the choice to work within your scope of practice. Working within your scope of practice means you can do whatever you're trained to do, licensed to do, and you have the right to work wherever you want within your scope of practice. All right, so if you answer B, false, you are correct. You have to stay in your scope of practice. If you're certified and licensed as a CNA, you can only work as a CNA. You can't do RN duties or LPN duties because you don't have that specific training at the moment. So that's why you can't work in any kind of scope of practice. You can't go in saying, I'm the doctor for today, and you have no doctorate, no license to be a doctor, no training to become a doctor and give the proper medication or treatment or insight of anything. You're falsifying your documents, you're falsifying your scope of practice, and that can make us lose our job and our license. All right, when it comes to checking your understanding, which of these is not the 6 principles of care that we discussed? If you answered C, impartiality, that is absolutely correct. We did not discuss that one, and that is definitely not a part of our 6 principles of care. Number 2, the goal of the healthcare team is to do what? What is it our duties to do? If you answer C, that is absolutely correct. We want to provide personalized quality care that meets the person's physical, emotional, and social, as well as spiritual needs. All right, number 3, which action a nurse aide assistant's responsibility? What is our responsibility as nursing assistants? If you answer C, you are absolutely correct. We assist people with activities of daily living, their ADLs. And the last one, number 4, the leader of the healthcare team is who? When we discussed this a little earlier on in our PowerPoint, what did we discuss? Who was the captain of the healthcare team? If you guys answer D, the person receiving care, that is absolutely correct. That person is the captain of the healthcare team, and if they can't make decisions, their family jumps into next. All right, so great job on everything that we've already talked about and covered. If you guys have any questions, please do not hesitate to ask. We are here to answer anything so that you have a better understanding of the knowledge that you're receiving when it comes to testing and moving forward. I want you guys to have a great day. All right, you guys, welcome to day 2 of week 1. I hope so far you're learning a lot of information. And if you haven't had a chance to ask your questions, make sure you get those questions answered because I don't want anybody hesitating on anything that's important you guys need to know. So let's jump right in. All right, during this session, we're going to discuss different types of care people receive. We're going to discuss what it's like to work in the healthcare settings of different types. We're going to identify names of people in the care of our CNAs. We're going to learn how patients, residents, and clients pay for their care. We're going to talk about the rights of patients, residents, and clients, and we're going to learn how caregivers and recipients of healthcare are protected. All right, you got 6 principles of care, which is CDIPSY, and we talked about it before. Communication, dignity, independence, privacy, safety control, and infection control. They play a major part in doing our jobs within the healthcare field, so it's important to know each and every one of them. When it comes to communication, good communication is the key. We want to listen, we want to be accessible, and we want to respond appropriately. When it comes to dignity, we're going to behave in a way that's not going to humiliate, or embarrass our residents. We remember that they used to be able to do things that they can't do right now, so it's our jobs to help them do most of those things, or at least give them the encouragement to continue to do it. We're going to provide respect, self esteem, and person first language. What if it was our family member? How would we want them to be treated? We wanted to treat them just how we want our family members to be treated. When it comes to independence, we promote that at all costs. We want them to be as independent as possible for as long as possible so that they can continue to feel good about what they got going on, how they're maneuvering through life, and just able to take care of themselves as a whole. We want to let them try to do things on their own. We're going to be patient. We're not going to rush them or get aggravated with them because they're taking longer than they should. We're going to be patient and we're going to encourage them every chance we get. When it comes to privacy, we're going to always keep private matters private. Our resident problems is not the topic of discussion when it comes to going in the break room and having conversations about certain things. And we want to treat our residents how we want to be treated. Actually, we're going to treat them better and hold them to a higher standard so that we can put them in a place where, okay, this is the person I'm taking care of. I don't want to make them feel any kind of way. I don't want to spread any kind of information that should not be spreaded. So I'm just not going to talk about them at all. Privacy is the key here. We have laws to uphold, and privacy is part of a law that we must maintain. When it comes to safety, Goodwill motto is safety first, safety second, safety always. We just want to be careful. We want to take our time and not rush our residents because when we're in a rush and we rush them, accidents happen. And we want to try to not have any kind of accidents pop up if we can control it. We want to follow safety procedures of the company and our facilities. So if we need to put door codes in place, we're going to do that. If we need to have signs up that lets them know, hey, not this way, or this is not a safe section, that we can do that. All right, when it comes to infection control, we are responsible for taking care of people in our care. So we want to take action to limit the spread of microbes, meaning wash our hands using appropriate PPE, not going to designated areas without the appropriate PPE on, just making sure that we're doing everything we can to not spread diseases from one place to another place. It could be airborne, it can be from touch. We just want to make sure that we are keeping the spread of diseases down as much as possible because they're not going to maneuver as much as we are or going from place to place as much as we are. So it's our responsibility. When it comes to ethics, we follow autonomy, justice, beneficence, non-maleficence, and fidelity. This is just guidelines for healthcare employees so that we can make sure we're doing the right thing at all times, at all costs. All right, when it comes to autonomy, it's just several key aspects that we must remember. When it comes to decision making, personal responsibility, we need to have knowledge of information that's being shared, be self sufficient and self efficient, and then respect for other individuals and their preferences. We want to make sure we put their preferences and their mind frames before ours. What might seem crazy to us may not seem crazy to them. So we want to make sure that we respect that. When it comes to justice, you need to be treated with respect. Just what we want is what we're going to do to our patients. We're not going to abuse them. We're not going to provide unnecessary restraints that's going to harm them or put them in harm's way. Justice in healthcare just implies that the patient should receive fair and impartial treatment, regardless of their insurance status, how much money they have, what gender they is, their ethnicity, or any other characteristics that we might find weird against what we really believe in. All right, when it comes to beneficence, this is principles that support the following morals and obligations that we must uphold. We want to protect and defend the rights of others. We want to prevent harm from occurring to others. We want to remove conditions that's going to cause harm. So that's involving closing a closet door or closing a dresser drawer, knowing that they might trip and hurt themselves and cause more problems than what we want to cause. We want to help persons with disabilities, and we want to rescue people in danger. We're just going to step in and we're going to do everything we can to keep them out of harm's way. That's our moral obligation. Non-maleficent has several morals that we follow as well, which is do not kill, do not cause pain and suffering, we do not incapacitate, do not cause offense, and do not deprive others of goods of life. So we just want to make sure that we're not doing anything that's going to hinder us or put us in jail or put someone else's life in harm's way. When it comes to fidelity, they get to remain in the facility until there's a good reason for them to transfer. So if they're in a facility longer than we want them to be, but there's no reason for them to transfer, they need our training, so it's necessary for them to stay, then they have a good right to stay, unless we come up with a reason that's beneficial to what they need in moving forward. They get a 30-day written notice before the transfer and a reason why the order was ordered, so that they can have an understanding of why they're being moved, and they get to hold their spots temporarily if it's something that they're going to go do short term, like get a little surgery done that's going to take a day or two, and they can come back to the facility for physical therapy and stuff like that. When it comes to ethical dilemmas, we just want to maintain health and wellness as a physician. We want to use social media professionally. And when we say that, I just urge everyone not to use social media while we're in certain facilities, because some things can be recorded that we don't think is wrong, and we can be hindered. It can be hindering us moving forward. It can cause us to get in trouble, cause us to lose our license. And it's something that we just think is so small. So try not to use your social media at all, and make sure it's professional at all times. We want to report incompetent and unethical behaviors by colleagues. So if you see a colleague doing something to your resident that should not be done, make sure you report it. We're a mandated reporter. So anything that's going to put our employees or our patients really in harm's way, we want to make sure we report it at all times. We don't want to accept gifts from our patients, no matter what it is, how big or small, because some of our patients just have memory issues and they don't remember. And what they gave someone as a gift could be next said that we stole it because they don't remember giving it to us. And we don't want to be in those situations. The Ethics Committee is just providing consultation services for the patients and their family members when it has different challenges that needs to be addressed and they don't know how to address it or who to address it to. They provide education to the healthcare employees and attend staff meetings to address certain issues that may have popped up that no one have thought about, and it came to the attention to the board. So now they want to discuss it with the members so that they know exactly how to move forward with those. And it just supports administrative staff when we review policies and procedures and make sure it helps with the healthcare background and how we maneuver within healthcare, keeping everybody morally protected. So I got a question. As a nursing assistant, in which type of healthcare setting would you guys want to work, and why? It's different facilities, different environments, different types of people that we're going to work with. Why do you want to work in that facility or in that kind of setting? I'm going to let you guys have a discussion amongst yourselves, and then we'll move forward. All right. So with acute care, these are for people who are injured or ill suddenly need short-term care. It's a short stay in the facility, maybe 1 or 2 nights, sometimes 3 or 4. Overnight is looked at as inpatient care because you're staying in the facility. And outpatient care is people who receive care within the facility but get treatment at home. You got hospitals, clinics, and surgical centers. So you go in for surgery, but you don't stay overnight. You get a surgical procedure, but you go home and someone looks after you when you go in and check in back and forth. When we have CNAs in acute care, can we think of some downsides to working in a acute care setting? What would be a reason that someone wouldn't want to work in these type of settings? Well, some things that I brought up were high turnover of patients, a lot of uncertainty about the patients and their family members. Most patients share room. There's fewer home comforts. So when I mean high turnover, when I say high turnover or talk about that, that's just having different patients every day, back to back. Somebody new. You're dealing with something different. So you can't really remember a person, remember how they acted, or remember what they need and what they want because it's a different person every day. Patients share rooms, so not only are you going in to care for one person and do something for them, then the other person that's in the room might need something done too. So now you're looking for 2 people at one time. And home comforts is less home comforts because you're not in the place where you're very comfortable at. You got subacute care. Where can we find subacute care? Within hospitals, nursing homes, long-term care facilities. These places require highly skilled staff. It can be a hospital, again, nursing home, long-term care facilities, and the stay is up to 30 days, usually no more than that. When working in subacute care, you got emotionally dependent patients, distress from patient and patient families, reinforcement of physical therapy. So, what physical therapy has set in place for their patients to get done, we go ahead and reinforce it when physical therapy isn't there. And we just encourage recovery. We push them as much as we can without overdoing it. Long term care. What are 2 major types of long term care settings that we want to talk about? Can anybody tell me offhand? All right. So when we're discussing these facilities, you got assisted living facility and you got nursing homes. That's long-term care facilities. We assist with medical, social, and personal needs over a longer period of time. They have 6+ months within the facility. And again, it's assisted living or a nursing home. So either we're hands-on fully or hands-on partially. With assisted living, you got some independence. We do help with ADLs. Most people have their own rooms or apartments, and the age range can be from young to elderly, depending on the mental illness, depending on the physical illness, depending on the mental disability or the physical disability. Also, in assisted living facilities, we do ADL assistance. We don't pass out medication or deal with medication, but we do medication reminders. So we remind them to take their medicine every day. That way they don't fall behind in their regimens. And we just encourage independence, keep them going as long as we can. Keep them taking care of themselves, keep them bathing themselves, keep them putting on their own clothes and feeding themselves. If it's anything that we could push them to do, we'll go ahead and do that. When it comes to nursing home, it's more of restorative care, emotional support. You got a lot of people who we lose within our care because it's a more of a nursing home. These are people who are not physically independent. They're more physically demanding than anything. We will provide ADL assistance for them, but it's during a time where they may be sicker than we think they are, and we tend to lose them. So we provide a lot of emotional support to them, to their family members, to the facility itself, to the employees because they got close with the residents or the patients. So it's a lot that goes into nursing homes. When it comes to nursing homes, they're usually elderly. They have chronic illnesses and conditions, debilitating conditions, mental disabilities. A lot of them have serious injuries, or some of them just have cognitive impairments that keep them from maneuvering on their own. When it comes to home health care, you got a subacute care, manage long-term conditions, but in the home. These people are not ready for long-term care facilities, so they stay home and they just get someone to come out and help them as much as they can. Keep and maintain their own free demand, honestly. When you work in home care, you could be a CNA or a HHA. The difference is a CNA is a certified nursing assistant with a license. A HHA is a trained home health assistant. They don't have a license, but they do have a certificate. We deal with ADLs, companionship, like housekeeping, meal prep, and we are on our own. We don't have a team that we can depend on to help us do our job. We are there in the homes ourselves, and it depends. Totally dependent on us. So who are they to us? You got a patient who receive acute care within a hospital. Residents usually get long-term care, nursing homes or assisted living facilities. You got short-term residents who have a stay between 3 to 6 months, depending on their condition. They're in long-term care facilities, and sometimes they get to go home. You got long-term residents who stay 7 months up to 2 years or even longer. They are stuck where they transition in, and they don't usually go home. And then you got a client who receives home health care within their homes. When it comes to paying for health care, it's either out of pocket from family, retirement, or savings. You got Medicare and you got Medicaid. So when it comes to Medicare, you got Part A, Part B. It's usually federally funded, 65 years or younger, depending on the disability they have or end-stage renal disease. Part A covers inpatient hospital stays, hospice, home health care, but not all. And Part B is medical insurance, which cover outpatient care, some medical supplies, some preventive services, and some doctor visits. You got Part C, which includes Part A and Part B, and some prescription drugs, and is usually provided by a private company. You got Part D, which is solely for prescription drug costs, and that doesn't cover all prescription drugs, depending on whether it's a narcotic with a high percentage of medication involved in it, or a certain medication that just not everyone has the benefit of getting. We have Medicaid, which is federally and state funded. It's for low income people, but not all adults in Florida, not any adults in Florida are available. You can't get it if you're a low income adult in Florida. It does cover basic health care, it covers long term care, and it covers children 18 and under. Why is this important? Why should we know how the patients pay for their medication or their health care? Because we're responsible for documenting all of this kind of stuff. Fraud becomes a big picture if we document the wrong thing in our work conditions. If we're not documenting what they're using, if we're using their information for somebody else, that's fraudulent charges that they're getting charged for that they're not necessarily utilizing. So we want to make sure that we document what they use, because a lot of people don't have a lot of money to pay for stuff that they can't get or haven't received. We don't want to falsely charge anyone for something that they just didn't benefit from. All right, you guys, we're at the end of day 2. We're going to go ahead and stop here. If you guys have any questions, feel free to go ahead and ask them now. If you don't have any questions, I just can't wait to go ahead and wrap this week up and see what you guys think about the first week. All right, have a good one. All right, everybody. Happy Friday. Welcome to day 3 of week 1. We're almost through it. For those who had any questions that didn't get a chance to get them answered, if you want to go ahead and ask those questions, this will be a perfect time to get that asked. If not, we're going to go ahead and move forward. All right, so during this session, we're going to define acts that were put in place to protect our residents. We're going to talk about legal documents that's used to protect residents' requests for health care. We're going to define illegal behavior, which nursing assistants may encounter. And we're going to define ethics and how healthcare workers can practice good ethics. All right, when we talk about legality in healthcare, are laws on healthcare ethics the same? All right, so we're going to establish the difference. Laws established by governments to keep people safe and provide a foundation for resolving conflicts. And ethics are moral principles that's used to guide us to do the right thing. So laws are put in place to make sure we're doing the right things, and ethics is what we are more morally brought up with when we grew up to make sure we do the right thing. You got rights. All our patients, clients, and residents, they got the right to competent care delivered respectfully. They got the right to know what kind of care they receive and how much it costs. They can make the decisions on what type of care they receive, and they can deny it as well. They have the right for confidentiality and privacy, and they have the right to not be restrained or abused. So it's our responsibility to make sure they're morally taken care of in all aspects of life, to make sure that we give them the most competent and respectful care that we can possibly give in healthcare. Rights. They are entitled to dignity, discharge, privacy, transfer, access, grievance, and self determination. There is nothing in the way on this board that does not give them access. They have the access to all of these. You got OBRA. This is something you may want to write down and remember because one of these will be on your test. It's Omnibus Budget Reconciliation Act of 1987. Nursing home residents will receive high level of care, standards for staffing. We want to promote the well being of residents, whether it's social, physical, mental, spiritual, or emotional. And facilities have inspections to make sure that they upholding the guidelines to take care of individuals or to have people work in facilities in environments that's suitable to take care of other individuals. You got PSDA, Patient Self-Determination Act. Patients can make decisions about their own care. This was passed in 1991. Patients can accept or refuse care. It does not matter what it is. They can deny medication that they just don't want to take because it makes them feel a certain way. They can deny food that we're trying to offer them because they just don't like it. They can deny the care provided by a certain person because they don't like how that person is caring for them. They have the right to refuse and they have the right to accept. Self-determination. Residents must be given choices. They got to own say about their health care plan and what goes and how it goes. They can be given the option to self-medicate if they want to, or they can let someone else on the staff take care of that for them. They are able to accept and refuse care. They got the option, again, they have the option to choose what healthcare provider they want to take care of them, what doctor they want to take care of them. They want to manage their own healthcare finances. They're able to do that until they're deemed incompetent enough. So they have the right to make a decision about what goes on in their life. We don't just come in and take over. Informed consent. Healthcare providers must have patients, residents, and clients consent before we conduct any kind of treatment. So a person can give a signature, they can voice it vocally, or they can non-verbally say yes or no to us as well in order to go ahead and give consent about whatever we're doing for them, whether they understand the benefits and risk of a procedure or a treatment that's about to be provided towards them. They must give their consent before we move forward. And they can also change their mind at any time. So even if they said yesterday and no tomorrow, that's all right. They have the right to do so. When it's time for us to obtain consent, We got the PSDA in tech, which says nursing assistants must obtain consent before we give care. This is why we go in, we knock on the door, we wait for them to answer, and then we walk up to them so we can explain what we're doing to them, making sure they understand what we're going to do, whether they're going to say yes or no, consent to it before we get started. And if they're reluctant, we'll just stop and try again later. We don't force them to do anything they don't want to do. A scenario. We got Miss Maria. She's a resident of ours who is scheduled to take a partial bed bath at 2 o'clock in the afternoon. After we announce our presence, we explain to her what we were about to do and assist her with a partial bed bath. And we ask her if that's okay, but she tells us no. Would you have still given her the bed bath anyways because it's on a care plan, or would you listen to her no and try again later? Advanced directives. This is put in place when a resident can no longer express themselves or express what they want. You got a durable power of attorney who is given the decision of making abilities over another person or over that person's behalf. You got a living will, which gives specific directions on what that person wants at the end of their life. And then you got DNR in place. So that just lets us know if something happened and it becomes to a life-saving matter, whether they want to be saved or not. If they have a DNR in place, they don't want to be saved. They want to go peacefully. If they do not have one in place, we do everything we can to go ahead and take care of that person. With a durable power of attorney, it's a legal document that allows a person to make healthcare decisions on behalf of another person. It can be given to anybody, whether it's the son, the mom, the aunt, the best friend, a coworker, anybody who they believe is a family member in a nature to where they'll go ahead and make decisions on their behalf. And this is active if the person no longer is able to take care of themselves or make decision of their healthcare choices. You got a living will, which is a legal document that gives directions for how that person should or should not be cared for to prolong their life if death is near. Otherwise, the healthcare team gonna jump in and do everything they can to make sure we help save that person's life, and we give them the most beneficial care as possible. Advanced directives. We don't want to confuse those with the durable power of attorney and the living will. Wills are a last testament of a person. Living wills are the same concept. Some healthcare facilities and companies will speak on behalf of the resident if they don't have anything in place, but for the most part, they usually make sure you have something in place so that they don't have to make the decision for you. HIPAA. They have the right to keep their medical information private. This is what I mean by not sharing any information with people who don't deserve the information. People who don't need to know what's going on, we keep it private at all times because HIPAA is a law that we must abide by in healthcare. It determines who can see and receive medical information. So if we're CNA and we're seeing certain medical information and we go share that with a person who's not supposed to be getting that kind of information, we're breaking their law. And we don't want to do that. And it also puts in place how medical information should be handled. Even though you're going to see another facility or another physician, it just tells that physician, hey, this person don't want you to see all their information. They only want you to see certain information, but they do want you to take care of them, or they want your opinion on how to be taken care of. When it comes to HIPAA, you only share information with need to know people or healthcare team members. We're not going to discuss that person information in private. We don't discuss it with patient or family members if they don't want us to. They usually put a code in place or a password in place that lets us know who can get the information about where they are or what's going on and who can't. And then it keep all your documentation secure based on our policies from whatever company that you work in. Ombudsmen. They volunteer patient advocates within different facilities. They just go ahead and discuss issues with patients and their family members that people feel may be right or wrong. And then they bring it to the attention of the facility so that the facility can handle an issue that's actually being brought to their attention that they knew nothing about. These ombudsmen act as non-biased people, so they get information from the family and the clients, and then they share the information with the company so we can figure out what we want to do moving forward as far as making the decision on how we can change what the issue is. When it comes to federal acts, you got to know the three. PSDA means independence. HIPAA is privacy, and OBRA is quality of care. OBRA, Omnibus Budget Reconciliation Act, is quality of care. Healthcare Insurance Portability and Accountability Act, which is HIPAA, is privacy. And Patient Self-Determination Act is independence. All right, when it comes to protecting us as healthcare employees, we have OSHA in place, Occupational Safety and Health Administration. They was established in 1970. It's a government agency and it protects us employees from industries and hazards. So we can be protected from different companies that we work for, depending on how they treat us, and it keeps us hazard free and make sure that the company is abiding all policies so that we don't have to run into any kind of issues that puts us in a bad situation. When it comes to accreditation, JACO or Joint Commission usually gives healthcare companies their accreditation, and they go through a couple of different classes or standards that they must uphold in order to go ahead and get that gold seal to say, hey, they did everything they needed to do. They met the standards of the accreditation organization, and here is their accreditation seal. When it comes to illegal behavior, you got abuse, assault, battery, negligence, fraud, and larceny. Some things may sound just alike, and they aren't in so many different ways. You got abuse, which is intentionally causing harm to another person. That's hitting, verbal torment, threats, not caring for a person who is dependent on others, or dependents, such as children and elderly who are at risk of being in harm's way because they can't look after themselves or voice for the opinions for themselves. You got abuse, you got four forms of abuse: physical, emotional, sexual, and neglect. Physical is deliberately doing something to somebody to hurt them. Emotional is degrading, belittling, or threatening that person to make them feel emotionally scared. Sexual is sexual contact without that person's consent. And neglect is failing to provide for a dependent person's basic needs. So basically taking care of them because they're dependent on us. You got Martha that likes to wander without a nurse noticing. Knowing that, the nurse threatens to lock her in a room. What kind of abuse would this be? What form of abuse would this be considered? If you guys said emotional, then that is absolutely correct. She's emotionally threatening her or making threats towards her to make her scared to do anything else that she may want to do. You got battery, touching somebody in a harmful manner, whether it's kicking, punching, pinching, or slapping. It's harmful to a person and it's known as battery. Negligence is not doing what somebody reasonable or careful would do. So we ignore a patient, forgetting different tasks that we're supposed to provide for them. We stop completing a task that goes above the level of training. So we go in a room and we open a drawer and we neglect to go ahead and close that drawer, knowing this person is stumbling and clumsy and they hurt themselves because of something we did. That's definitely neglect. We know that we are trained to lock a wheelchair. So, for an example, Nurse Patty trained to lock a wheelchair, and she parked the chair, but she forget to lock the brakes, and that resident try to stand and fall backwards. That's neglect because we know to lock the brakes at all times, anytime it's being utilized. Another example, Nurse Jim, my legs hurt. Can we sit down for a minute? But that nurse don't let him sit down and he fall. That's neglect because he's asking us to sit down, letting us know that his legs hurts for a little bit and he needs a little break, and we neglect to do that. All right, you got a scenario. I want you guys to talk about it. What is this an example of? If you guys mention anything about neglect or negligence, this is definitely correct because he neglected again to let him take a minute to sit down before they kept going and he ended up falling. All right, you got assault when a person is afraid of being touched harmfully. So you can raise your hand at a person as though you're going to hit them. That's assault. Threats. If you don't eat, I'm going to put the hope in your mouth and shove the food down it. That's assault because we're verbally assaulting them. We're verbally making them scared to be around us, making them scared to say anything to us. We just don't want to do that. You got fraud, which is lying to gain an advantage. Caregivers say that they gave a client care and they really didn't. We don't want to go ahead and say we bathed someone or we ordered a stethoscope or a thermometer for somebody, but we didn't do it for them because now we charted it on the charts. They getting charged for it, and that's fraudulent activities that we just did when we really didn't provide them with anything we said we did. You got larceny, stealing, which is taking additional payment from a resident or a person, even though we receive a paycheck. We don't want to take anything from our clients or our residents. So if they offer it to us, go ahead and tell them no, just because we might commit larceny. And again, they may forget that they even said, yes, hey, here, take this. I wanted to do this for you. They could say that you stole it. You don't want to be put in that position at all. So a recap, we talked about ethics, which is behaviors, laws, living wills and advance directives, PSDA, HIPAA. When it comes to checking our understanding, which legislation establishes quality of standards for our residents and of nursing. When we talk about the different legislations that we went over, who provides quality standards of care? If you answered C, OBRA, you are absolutely correct. All right, which legislation supports a patient's, residents, or client's right to make decisions about their own behalf? HIPAA, advanced directives, PSDA, or patient autonomy? If you answered C, that is absolutely correct. Self-Determination Act. All right, you want to check your understanding. You got a suspect. Well, you suspect that Ms. Jellison is one of our home health care clients and she's abused by her son. The woman becomes withdrawn and fearful anytime that he's around or in the room. And you notice some strange bruises on her arm. What would you do? This is talking about if you're in a home health care setting. Are you going to A, call the police immediately? B, confront the son and tell him to stop, or you will call the police? C, report your concerns to the supervisor at the agency? Or D, nothing. It's a private family matter. Okay, so if you answer C, that is absolutely correct. You want to report that concern to your supervisor at the agency and let them handle it moving forward. Because if you confront the son while you're in the home, he might turn his anger towards you and starts to try to batter you. If you call the police immediately, you'll still be put in that same morally crazy situation to where he turned his anger towards you. And if you don't do anything, it's going to keep happening until it's not a good situation. All right, so in our lesson recap, we talked about different types of care people receive, what it's like to work in each healthcare setting. We learned how patients and residents and clients pay for their care. All right, it's Friday and we're at the final touching of this week. If anybody has any questions that has spurred up, please do not hesitate to ask. Again, I want you guys to have a great weekend and we'll move forward.